Welcome back to Health Live, everyone. Today we're going to be going deep on something that I know can be a little bit tough to talk about.
Yeah,
But it's so important for all of us to understand.
absolutely.
And that is cancer staging.
Definitely.
We're going to try to decode what these stages really mean and what's actually going on in the body.
Right.
When someone is diagnosed with stage 1, stage 4, or really anywhere in between.
It's definitely a topic that brings up a lot of anxiety for people.
Oh, for sure.
But I think understanding the staging system can actually really empower you to make informed decisions.
Absolutely. And so you were nice enough to send over this incredibly detailed medical document that breaks down the T&M staging system.
Yes.
And I have to say, I was highlighting like crazy just in the first couple pages.
It's fascinating, isn't it?
Yeah,
It's like the Rosetta Stone of cancer diagnosis.
it really is.
And it's used worldwide, so it's really important.
That's incredible.
Yeah, so that doctors everywhere are on the same page when it comes to diagnosing and treating cancer.
Okay, so before we get into the stages themselves,
Yeah.
let's just break down this T&M code.
Sure.
It sounds a little bit like something out of a spy movie.
It does have a little bit of a secret code vibe to it, doesn't it?
Yeah.
But it's actually quite simple.
Okay.
T&M just stands for tumor node metastasis.
Okay.
So think of it like a checklist
Got it.
that doctors use to kind of assess how far a cancer has spread.
Okay, so T is all about the tumor itself.
Exactly.
So the size of the tumor and if it's invaded nearby tissues.
That's exactly right.
Okay, N is for lymph nodes,
Yes,
those tiny bean-shaped organs that are part of the immune system.
that's right.
Okay, and that M is the one I think everyone's probably a little bit nervous to hear about,
Yeah.
metastasis.
Yes.
Meaning it's spread to other organs in the body.
Yes. The M indicates whether the cancer has metastasized, meaning it has traveled to other parts of the body.
Okay, so based on this T&M code, doctors can then assign a stage to the cancer.
Precisely. And there are 4 main stages. Stage 1, Stage 2, Stage 3, and Stage 4.
Got it.
And each stage carries different implications for treatment and what we call prognosis, meaning the likely course of the disease.
Got it. So let's dive into what each stage actually means for a patient.
Okay.
Starting with stage 1.
Here.
Most people would assume that's the earliest and hopefully least serious stage.
You're absolutely right. Stage 1 is often referred to as localized cancer, meaning that the tumor is confined to the organ where it originated and is relatively small.
Okay.
There's no spread to lymph nodes or other organs.
I know just hearing the word cancer is very scary for a lot of people.
Absolutely.
But stage 1 almost sounds like good news, relatively speaking.
It really can be. In many cases, the 5-year survival rate for stage 1 cancers is incredibly high, often over 90%.
Wow.
You actually have a higher chance of surviving a stage 1 diagnosis than getting struck by lightning in your lifetime.
That really puts it in perspective.
Yeah.
So at this stage, what does treatment usually involve?
So the primary focus at this stage is on surgically removing the tumor.
Okay.
And sometimes doctors recommend radiation therapy as an additional measure to kill any remaining cancer cells in the area.
So early detection surgery and potentially radiation.
Exactly.
That's the key takeaway for stage 1.
Exactly. And this is why regular screenings and being proactive about your health are so crucial.
Right.
Catching cancer early dramatically increases the chances of successful treatment.
Okay, let's move on to stage 2.
Okay.
Is that still considered an early stage of cancer?
It's what we call locally advanced.
Okay.
So the tumor might be larger than in stage 1, or it may have spread to a few nearby lymph nodes.
Okay.
But importantly, there is still no evidence of distant metastasis.
So it's progressed a bit, but still contained.
Exactly.
What happens to the survival rates at this point?
They do decrease somewhat with the 5-year survival rates, typically ranging from 60% to 85%, depending on the specific type of cancer.
Okay.
But the odds are still generally good.
And I imagine treatment gets a little bit more intense.
So you are likely to see a combination of surgery and radiation therapy in stage 2.
Okay.
And in some cases, especially if there's lymph node involvement, doctors might recommend chemotherapy after surgery.
And just to clarify for our listeners, chemo is like bringing in the big guns to make sure any stray cancer cells are wiped out.
It's a powerful tool that can significantly reduce the risk of the cancer recurring.
Okay.
Now, things start to shift when we get to stage 3.
Okay.
This is where the cancer takes on a more serious, regionally advanced form.
And this is the stage, I think, where a lot of people probably start to feel overwhelmed.
Yeah.
And maybe even a bit hopeless.
That's understandable.
Yeah.
But it's important to remember that even at stage 3, there are still many treatment options available.
Okay.
And hope is absolutely not lost.
That's good to hear.
Yeah.
So walk us through stage 3.
Sure.
What exactly does regionally advanced mean?
It means that the cancer has grown larger and is more deeply rooted in the area where it originated. Lymph node involvement is more extensive, and it might have even spread to nearby tissues.
But still no distant metastasis.
That's a crucial point.
Okay.
While it's more advanced locally, it hasn't spread to distant organs, and this distinction is really important in terms of treatment options and prognosis.
Okay, so what kind of survival rates are we looking at for stage 3?
The 5-year survival rates for stage 3 typically fall between 30% and 60%.
Okay.
So that is a significant drop compared to the earlier stages, but it still means there is a fighting chance.
Yeah, and treatment, I imagine, becomes much more aggressive.
It is often what's called a multimodal approach.
Okay.
This means doctors use several different treatment methods together to attack the cancer from multiple angles.
So instead of just surgery or just radiation, it's kind of all of the above?
Exactly. Surgery might still be an option, but it might be more extensive.
Okay.
What we call radical surgery.
Okay.
This involves removing a larger area of tissue to make sure they get all of the cancer.
Got it. They'll often use radiation therapy before or after surgery, and chemotherapy is almost always part of the plan to kill any cancer cells that might have escaped the original tumor.
Wow. So it's like a full court press at this stage.
It really is. The goal is to eradicate the cancer completely, but we also have to be realistic about the challenges of treating a more advanced disease.
Okay, so we've covered stages 1, 2, and 3.
Yes.
Now let's talk about the most advanced stage, stage 4.
Okay.
I know this is where a lot of people feel the most fear and uncertainty.
It's definitely the stage that carries the most weight,
Yeah.
both emotionally and medically.
So at stage 4, this is where the cancer has spread to other organs, correct?
Yes, stage 4 is metastatic disease.
Okay.
This is where that M in the TNM system becomes a 1,
Okay.
indicating distant metastasis, and it does change the conversation in many ways.
What are some of the most common misconceptions people have about stage 4 diagnoses?
I think one of the biggest misconceptions is that it's an automatic death sentence.
While it's true that the prognosis is more guarded at this stage,
Yeah.
it's important to remember that new treatments are emerging all the time,
Right.
and we're seeing survival rates improve for many cancers.
Yeah.
There's always hope, and there's still a lot that can be done.
So even though it's the most advanced stage, there's still a chance, and there's still a lot that can be done.
Absolutely. The focus at this stage often shifts from aiming for a cure to extending life as much as possible and maintaining the best quality of life.
Okay.
So it's about managing the disease and its symptoms, not necessarily eradicating it completely.
And what kind of treatments are used for stage 4 cancers?
Well, systemic chemotherapy is often used to try to shrink the tumors. Targeted therapies and immunotherapy are also playing an increasingly important role, especially for cancers with specific genetic mutations that can be targeted.
So it's about finding the most effective way to control the cancer
Right.
and manage the symptoms, rather than just trying to get rid of every last cancer cell.
Exactly. Radiation therapy might also be used, but at this stage, it's usually focused on relieving symptoms like pain or bleeding, rather than trying to eliminate the cancer entirely.
And I imagine palliative care becomes a much bigger part of the conversation at this stage.
Absolutely. Palliative care focuses on providing comfort and support to the patient and their loved ones.
Okay.
It's about addressing the physical, emotional, and spiritual needs that come with a serious illness.
So even though it's the most challenging stage, there are still many options available to help people live as well as possible for as long as possible.
That's a really important point. And we've seen remarkable advances in palliative care that can significantly improve quality of life for patients with advanced cancer.
Now I have to ask, in stage 4, is surgery ever an option?
It's a good question.
Because I thought once it's spread, surgery isn't usually possible.
You're right. In most cases, surgery isn't the primary approach for stage 4 cancers. However, there are exceptions. Sometimes if someone responds exceptionally well to systemic treatments like chemotherapy or immunotherapy, and the cancer shrinks significantly, doctors might consider more aggressive options like surgery or localized radiation therapy to target specific areas where the cancer is still lingering.
So it's not completely off the table,
No.
but it's very much determined on a case-by-case basis.
Precisely. It depends on many factors, including the type of cancer, the patient's overall health, their response to previous treatments, and their personal goals.
This has been so insightful.
Right.
We've gone from that SPY code TNM system to understanding what each stage means in terms of the tumor lymph nodes and metastasis.
Right?
But I think it's important to acknowledge that while staging is incredibly useful, It's not a crystal ball.
You're absolutely right. While it provides a framework for understanding the disease, it doesn't predict an individual's outcome with 100% certainty.
So while it's an essential tool,
Yes.
it's crucial to remember that it's just one piece of the puzzle.
Exactly. Each individual's journey with cancer is unique, and factors beyond the stage, like their genetics, their overall health, their access to care, and even their lifestyle choices can play a significant role in their experience.
I think that's such an important reminder for anyone going through this. But we've got even more to discuss.
Yes, we do.
Like why staging matters so much.
Right.
And how it impacts the entire landscape of cancer care. So let's dive into that
Okay.
after a quick word from our sponsors.
Welcome back to Health Live.
We've been breaking down the complexities of cancer staging, and it's clear that understanding those stages is really just the tip of the iceberg.
Yeah, it's not just about knowing the stage, it's about understanding why that information is so critical.
Right, and we've touched on this a bit, but I really want to dig into why staging matters so much.
Sure.
It's more than just a number, right?
Absolutely. It's a cornerstone of cancer care.
Okay,
Think of it like the foundation of a house.
okay.
Without a solid foundation, the whole structure is compromised.
Okay, I like that analogy.
Yeah.
So what are some of the key reasons why staging is so vital?
Well, first and foremost, it provides that essential standardization we talked about earlier.
Right.
So a stage 2 lung cancer in New York means the same thing as a stage 2 lung cancer in London or Tokyo.
That's crucial for making sure everyone is speaking the same language.
Exactly.
Doctors need to be able to communicate effectively no matter where they are in the world.
Exactly. It allows for seamless communication and collaboration among doctors and researchers around the globe.
And this global consistency also makes it possible to compare treatment results and advances, which is essential for progress.
Absolutely. When researchers are conducting clinical trials to test new treatments, they rely on this standardized staging system to make sure that they're comparing apples to apples.
Right.
This allows them to track progress and make meaningful comparisons across different studies and populations.
Okay, so we've got the global standardization piece.
Yes.
What else makes staging so critical?
It directly informs prognosis, which is the likely course of the disease. So knowing the stage helps doctors give patients a more accurate picture of what they can expect, both in terms of survival rates and potential treatment outcomes.
Okay.
It's not about predicting the future, but it helps us to kind of understand the general trajectory and make more informed decisions.
Right, and that's where those 5-year survival rates we talked about come into play.
Exactly.
So if you're diagnosed with a stage 1 cancer with a very high chance of survival, you might opt for a less aggressive treatment approach.
Exactly. And conversely, a stage 3 diagnosis might lead you and your doctor to consider a more aggressive multimodal strategy. It's about weighing the potential benefits and risks of different treatments in the context of your specific stage.
So it's not just about the numbers, it's about using that information to make personalized decisions that align with your individual situation and your goals.
Precisely. And that brings us to another really crucial point, treatment planning.
Okay.
Staging is like a roadmap that guides the entire treatment strategy.
Right. We saw how the treatment approach tends to escalate with each stage. Stage 1 might be surgery alone. Stage 2 might add radiation. And by stage 3, you're looking at a combination of surgery, radiation, and chemotherapy.
And even within those treatments, there are so many variations and nuances.
Right.
So the type of chemotherapy or targeted therapy will also be determined by the stage and the specific characteristics of the cancer. So staging helps us kind of narrow down the options and choose the most effective approach.
So staging is like the conductor of an orchestra, guiding each instrument, each treatment modality to play its part at the right time and in the right way.
That's a great analogy.
Thanks.
And finally, let's not forget the impact staging has on research. It allows researchers to group patients with similar disease characteristics,
Okay.
which is essential for designing and conducting those clinical trials we talked about.
Right. So instead of just throwing everyone with breast cancer into one big study, they can separate them by stage and other factors to get more accurate and meaningful results.
Exactly. Staging allows researchers to study the effectiveness of new treatments within specific stages, leading to more precise and ultimately more effective treatments for patients.
And that translates to better outcomes and hopefully longer lives.
Pretty nicely. So as you can see, staging is far more than just a number.
For sure.
It's the foundation upon which the entire edifice of cancer care is built.
It guides diagnosis, prognosis, treatment, and research. And for patients' understanding, the staging system can empower them to be active participants in their own care.
Absolutely. It equips them with the knowledge to ask informed questions, understand their options, and make decisions that align with their values and priorities.
Okay, so we've established that staging is vitally important.
Yes.
But I think it's also important to acknowledge that it's not a perfect system, right?
You're right.
Yeah.
While it provides a really valuable framework, there are limitations.
For instance, two people with the same stage of cancer can have very different experiences and outcomes. We can't forget that human element here.
Absolutely. Cancer is incredibly complex, and the staging system can't capture every nuance of the disease or every individual's response to treatment.
Right.
Factors like genetics, overall health lifestyle, and access to care can all play a role.
So while staging is a crucial tool, it's important to remember that it's just one piece of the puzzle.
Exactly. Each individual's journey with cancer is unique.
Right?
And staging provides a starting point, but it's not the whole story.
And this is where that open communication between doctors and patients becomes even more crucial, right?
Absolutely. It's essential to have honest and thorough discussions about, the meaning of the stage, the potential benefits and risks of different treatment options, and what to expect throughout the course of treatment.
So while staging can provide a roadmap, it's not a substitute for personalized care, shared decision-making, and open communication.
Well said. It's about using the information provided by staging as a springboard for informed decision-making, recognizing that each individual's journey will be unique.
Okay, we've covered a lot of ground here.
Yes, we have.
We've decoded the TNM staging system, explored why staging matters so much, and acknowledged its limitations.
Yeah.
But there's one more aspect of staging I want to explore.
Yeah.
Its role in the evolution of cancer care. It's not a static system, is it?
That's a great point.
Yeah.
The staging system is constantly evolving as our understanding of cancer grows. It's a dynamic system that reflects the incredible advancements happening in cancer research every day.
So what does that mean for patients and doctors?
Yeah.
How does this constant evolution impact their decisions and the course of treatment? Let's delve into that right after this short break. Welcome back to Health Live for the final part of our deep dive into cancer staging.
It's been quite a journey, hasn't it?
Yeah, it really has. We've gone from deciphering that SPI code TNM system to understanding why staging is so vital.
Absolutely.
And we even acknowledge that it's not a perfect system.
Right, it has limitations.
One thing that keeps coming back to me, though,
Yeah.
is just how much cancer research has advanced
Oh, absolutely.
in recent years. It seems like every day there's a new breakthrough.
It's truly remarkable. We're seeing incredible progress in immunotherapy-targeted therapies, and even in our understanding of the genetic basis of cancer.
Yeah.
It's an incredibly exciting time to be in this field.
And all of these advances are directly impacting the staging system, right?
Absolutely.
It's not like it was set in stone decades ago.
Right.
And never changed.
As we learn more about cancer, we refine our ability to classify it accurately.
Right.
And that leads to more precise staging.
Okay.
So the system is constantly evolving to reflect our growing knowledge.
So it's not a static system.
Yes.
It's dynamic
Yes.
and responsive to new discoveries.
Precisely. New discoveries often lead to adjustments in how we define and categorize different stages.
All right.
And sometimes it's a subtle tweak.
Right.
And sometimes it's a more significant shift in our understanding.
Can you give us an example of how this evolution plays out in real life?
Sure.
How has a specific type of cancer's staging changed
Yeah.
because of new research?
Certainly. Let's take the example of breast cancer.
Okay.
In recent years, we've identified new biomarkers and genetic subtypes that have revolutionized our understanding of the disease.
And these new insights have led to changes in the staging criteria.
Yes.
What a stage 2 breast cancer means today might be different from what it meant 10 years ago.
Exactly. For example, the inclusion of HER2 status, which is a protein that can drive breast cancer growth, has become a key factor in staging.
Yeah.
We now know that HER2 positive breast cancer tends to be more aggressive.
Got it.
So it's factored into the staging to ensure a more accurate assessment of prognosis and treatment planning.
So two women might have tumors of the same size and lymph node involvement, but if one is HER2 positive and the other isn't, they might actually be assigned different stages.
That's right. And their treatment plans might be significantly different as well.
Okay.
We have targeted therapies that specifically target HER2.
Right.
So that would likely be a key part of the treatment strategy for the HER2 positive patient.
That makes perfect sense. So what does this constant evolution mean for patients who have already been diagnosed and staged?
Right.
If someone was diagnosed with stage 2 breast cancer 5 years ago, could their stage change today based on new information?
It's a great question. It means that staging isn't necessarily a one-time event.
Okay.
As new information emerges, it's possible that a patient's stage might be reassessed.
Got it.
But this doesn't happen automatically.
So it's really important for patients to stay informed and have ongoing conversations with their doctor.
Right.
About any new developments that might affect their staging or treatment plan.
Absolutely. And this is where that strong doctor-patient relationship we talked about earlier becomes even more critical.
Right.
It's a partnership, and open communication is key.
It's about being an active participant in your own care.
Mm-hmm.
Asking questions, doing your research, and staying abreast of any advances that might be relevant to your situation.
Precisely. And remember, even though staging can feel complex and sometimes overwhelming, it's ultimately designed to empower patients and doctors to make the best possible decisions.
Yeah.
It's a tool to guide us, not a dictator.
It's about using the most accurate and up-to-date information to guide treatment, manage expectations, and just navigate that journey with cancer as effectively as possible.
Well said. And I think that's a perfect note to wrap up this deep dive.
Yeah, I agree. We've covered a lot of ground, from the nuts and bolts of that T&M system to the nuances of how staging evolves alongside cancer research.
Absolutely.
And we've emphasized that while staging is a powerful tool, it's just one piece of the puzzle.
Right.
Personalized care, open communication, staying informed are all essential components of navigating a cancer diagnosis.
Absolutely.
If there's one thing I want our listeners to take away from this episode, it's that knowledge is power.
Absolutely.
Understanding cancer staging can empower you to be an informed advocate for yourself or a loved one.
Don't be afraid to ask questions.
Yeah.
Seek out reliable information and engage in open and honest conversations with your healthcare team.
And remember, even though cancer is a formidable opponent, we are constantly making strides in research and treatment. There's always hope, and there's always more we can do to fight back.
Thank you for joining us on this deep dive into cancer staging.
Yeah.
We hope you found it informative and empowering.
We'll be back next week with another deep dive into a fascinating health topic. Until then, stay curious and stay well.